early. Use your full name when logging in. Join a few minutes before the 10 a.m. start time to resolve any technical issues beforehand. During the conference, keep your microphone muted unless you are speaking to avoid background noise. Stay focused. Give your full attention to the proceedings. Avoid multitasking. Video guidelines. Turn on your video to remain engaged in the conference. Turn off your video if it may be distracting to others. You would be required to turn on your video when speaking. Ensure your attire and background are appropriate. Contribute thoughtfully. Use the raise hand feature to indicate you wish to speak and wait to be recognized. Use the chat feature for relevant comments, questions, or to signal contributions. General conduct. Be respectful. Maintain polite and professional language in all interactions. Maintain professionalism. Conduct yourself as you would in an in-person setting. Thank you for your cooperation and understanding.
Okay, thank you very much. So I will now go ahead and establish the protocol for today's event. The first on the protocol list is the Vice Chancellor of the University of Port Harcourt and the Chief Host of the Scientific Conference, Professor Owunari Abraham Georgewill. I'm sure he has, although he's on his way from the UNGAS, the United Nations General Assembly, but I'm sure that he will join us whenever he could. Okay. The other one, the next is the chairman of the day, Professor Ernest Achalom, the professor of health and safety education in the University of Port Harcourt, is right here with us. The keynote speaker is Professor Father Walter Chinwendo Ihejirika, Professor of Development, Communication and Media Studies, and currently the Dean of the Faculty of Media and Communication Studies, University of Port Harcourt. The Deputy Vice Chancellors of our university, Professor Chukwudi Onyaso, the DVC Administration, Professor Rosemary Ogu, DVC Academic, Professor Angela Frank Briggs, DVC Research and Development. Members of the University of Port Harcourt Governing Council, I want to especially recognize the presence of Professor Kelechi Okonta, Professor of Cardiothoracic Surgery, and Professor Olufemi Martins Adesokwe, the multi-talented Professor of Agricultural Extension and Development Studies. The registrar of our university, Dr. Mrs. Gloria Chinda, and other principal officers of the university. The acting provost of the College of Health Sciences, Professor Ngozi Ekeke, the dean of the School of Graduate Studies, Professor Kinikanwo Anele, deans of other faculties. I want to especially recognize the dean of my faculty, that is the Faculty of Clinical Sciences, Professor Macklin Akpa, Professor Obunge, the dean of the Faculty of Allied Health Sciences. And then, of course, once again, let me recognize Professor Ihejirika in his capacity as the Dean of the Faculty of Media and Communication Studies. Directors of institutes and centers, I want to especially recognize Professor Ogaji, DST Ogaji, the center leader of the African Center of Excellence for Public Health and Toxicological Research. The panel discussants on the theme of the day, which is making medicine out of health talk, Dr. Doris Nria, a retired River State health communicator, Dr. Godia Ekenedo, the River State chairman, Ekenedo, yes, Ekenedo, the River State chairperson of the Association for Health Education, Dr. Dinah Babo, the River State Health Communicator, and then Professor Obiageli Pauline Ohiago, a professor of Digital and Communication Studies. Distinguished guests, I want to specially recognize the, the president, executive, and members of the National Association for Health Education, and then the president, members of the Association of Public Health Physicians, especially those in River State. Okay, so professors, lecturers, and supervisors of the University of Port Harcourt School of Public Health. I want to especially recognize Professor Charles Tobin West, the Deputy Director of the School of Public Health and a former acting CMD of our teaching hospital. That is the University of Port Harcourt Teaching Hospital. I want to also specially recognize the coordinators, lecturers, and supervisors in the Health Promotion and Communication Division of our school, especially Dr. Doris Nria, Professor Father Walter Inhechrika, Professor Ohiagu, Professor Ochonogo, and other lecturers in the Faculty of Media and Communication Studies. Past, and I want to also recognize past, retired, and present lecturers in my department, especially our current HOD, Professor Madoka, and my man, Professor Kingsley Douglas. Management and staff of the University of Port Harcourt School of Public Health, especially the admin secretary and the finance officer, colleagues and students of the School of Public Health, ladies and gentlemen. So I have established the protocol for today's event. So I will now go ahead and give my welcome address. So this is a welcome address delivered by me, Professor Best Ordinary, Director of the School of Public Health, on day 11 of the first scientific conference of the School of Public Health, the day dedicated to health promotion and communication. It is with great honor that I welcome you all to day 11 of the first scientific conference of the School of Public Health of the University of Port Harcourt School of Public Health, the day dedicated to health promotion and communication. The University of Port Harcourt School of Public Health was established in January 2019 by the Senate of the university as a semi-autonomous academic center, to provide postgraduate education in public health and the allied health sciences. The semi-autonomy of the school gives it the power to set and collect fees and then use the collected fees to run its programs, but subject to the rules and regulations of the university. This gives the school the wherewithal to recruit and pay ad hoc lecturers from within and outside the country and from the industry to lecture in the academic and to lecture in its academic programs. The school is thus able to recruit the rich talent in NGOs, private and public organizations in Nigeria, ensuring that it has world-class faculty with diverse background, experience, and training. The University of Port Harcourt School of Public Health has been so successful in recruiting the best hands, the best talents all through the country that is finding it difficult to find external examiners who have not had any formal didactic contact with its students. The school started with 4 academic programs, but currently runs 3 PGT programs, 10 master's degree program, including a master's in health promotion and communication, a doctor of public health program, which is a professional doctorate, and PhD programs in all the subspecialties of public health, including a specific PhD program in health promotion and communication. Academic programs in the University of Port Harcourt School of Public Health are deliberately designed to be both academic and professional, to sharpen the research skills of students and prepare them for a career in the academics without emphasizing, while emphasizing the practical skills that are needed for professional work. The results of these have been very remarkable, as the graduates of our various programs, irrespective of their first degrees, often secure employment in the health sector a few months after graduation, and are even known to perform much, much better than others. In fact, we have a lot of graduates. We have trained a lot of graduates from the Faculty of Science, science, lab, tech, even up to humanities. Even up to humanities, we have trained, we have admitted them into our programs, and we have trained them. And a lot of them are now gainfully employed, with even several of them gainfully employed abroad. They are now gainfully employed abroad. In fact, it's one of our selling points. It's one of our selling points. The success of our graduates in the labor market and their achievements in their jobs can be attributed to our competency-based curriculum, expertly delivered by our lecturers who are drawn from the academia, industry, and government. We not only teach the principles as is standard in most postgraduate programs in Nigeria, but also lay emphasis on the practice to ensure that the graduates of our academic programs are industry ready. Practice is embedded in every lecture given to students of the School of Public Health. The practical implication of the principle taught are often stressed and reinforced with case studies. Well, some people think that case studies are only used in MBA programs. No, it is a staple in the lectures we deliver in the School of Public Health. So our students, in addition to this, our students have access to short courses that teach specific competencies that are relevant to their programs of study, and these short courses are certificated separately. So at present, most of the short courses offered to our students are developed from within the school, but we are looking at other possibilities. We are not going to collaborate with Coursera and the others. No, we are going to develop our own indigenous short courses that are relevant. They are relevant to the Nigerian practice. So that's why we are calling on professional associations, and even private consultancies to collaborate with us in designing these short courses. The thing there, yes, and of course we have our students. We have a lot of students, and anybody collaborating with us will be sure that the short course will have at least 100 enrollees. So I'm sure that that will be interesting to them. So because the standard in the School of Public Health, the typical student graduates not with a postgraduate degree, but several competency certificates, proficiency certificates of these short courses. So we are looking at the possibility of a graduate from our master's in health promotion and communication program, graduating with, of course, the degree, but also in certificate, also with proficiency certificates such as in social marketing, self-management of diabetes, risk communication, behavioral change communication, advocacy, and community mobilization. So if this will definitely enhance their employability. Please note that employers, they don't often ask for transcripts. So the best way to tell the employer um, about the skills possessed by the applicant is for the applicant to tender these certificates. In fact, this is ingenious. And probably that is one of the reasons. That's one of the reasons why our graduates easily find employment, why other graduates are suffering. Oh, I just let out a trade secret. But we can share. We can share. We can share with the others. So about our Masters of Science program in Health Promotion and Communication is not just a master's degree in health education, but consists of two components: health promotion and health communication. Health promotion has been defined as a process of empowering people and community to gain control over their health by increasing control over the many factors that influence their well-being. It has also been defined as a process of making healthy choices easier through a blend of health education on lifestyles and other determinants of health policies, and legislation. This component of our Masters in Health Promotion and Communication program is taught predominantly by lecturers in the Department of Preventive and Social Medicine of our medical school. The health communication component is, however, taught by lecturers, predominantly by lecturers in the Faculty of Media and Communication Studies of our university, but with significant contributions by lecturers in the Department of Preventive and Social Medicine. Health communication, yes. So the key components taught in our program, in our Masters in Health Communication and Health Promotion and Communication program include health education on healthy practices and lifestyle, patient self-management education, behavioral change communication, risk communication, social marketing, community mobilization, and advocacy. We therefore believe that our graduates, the graduates of this program, have the competence to contribute meaningfully to the practice of health promotion and communication. Making medicine out of health talk is the theme of day 11 of this our scientific conference, the day dedicated to health promotion and communication. This day gives us the opportunity to deliberate on ways of mainstreaming the use of talk in the promotion of health and in the prevention and management of diseases. Talk is commonly used in healthcare, especially in religious settings, to ensure social, mental, and physical well-being. Social health has been defined as the ability to build and maintain healthy, fulfilling relationships, connection with community, and adaptation to social settings. It encompasses the quality and the quantity of relationships which are built on trust, empathy, and responsibility, providing vital support and contributing to overall physical and social well-being. Talk is used in circular settings to promote equity and social justice. In fact, these are the guiding principles of public health: equity, treating unequal equal, allocating resources based on based on the needs of the person, and of course, yes, and social justice, ensuring that the poor, that the rich contribute towards the healthcare of the poor, so that the poor, so that the rich will have, so that the poor will recognize the usefulness of the rich. Yes, yeah. So instead of praying for the rich man to die in a village, if the rich man contributes like 10% of his wealth uh, in taking care of people in the community, they will rather pray for him, because 10% of my salary is not the same thing as 10% of Dangote's salary. So they will rather pray for me to become like Dangote, so that there will be enough money. So that is what is practiced in um, in the secular settings of public health. But in religious settings, it is social health, that's relationship between human beings, uh, are usually encouraged with sermons like love thy neighbor as you love thyself. That is a way, with that, talk is able to um, facilitate social well-being, social health, the good relationship between human beings. Mental health is defined as the state of well being that allows a person to cope with life stresses. The pinnacle of it is what is called, what is found in the Bible, is that passes all understanding. That is the pinnacle of mental health. So, talk and sometimes performance is used to elicit the placebo effect that dulls pain, endows great strength, and aids recovery. Psychotherapy is a potent talk therapy that delivers mental health, but this is commonly used in circular practice. This is commonly used in sorry. This is commonly used in circular practice. Also effective are religious sermons and Bible passages like "Cast your burden unto the Lord, and He will sustain you," or and "Come unto me, all ye that labor and heavy burdened." With those, one can get one can get mental health. One can resolve one's mental health issues. So physical health means being physically strong to effortlessly carry out your everyday activity, and um, this is what is commonly found in health talk used in hospitals, and they can be therapeutic. They have been found to be very therapeutic. For example, education on the health procedures, such as how to make this salt sugar solution for the treatment of diarrhea, have actually been found has actually been found to save millions of lives. What of health education programs for chronic diseases like diabetes, that have been found to improve the health and longevity of the patients, and then behavioral change communication that helps people, including people with addictive lifestyle like smoking and substance use. Talk have actually been used to help them change this unhealthy behavior. I am sure that the experts lined up for today's event will provide further insights on into how talk can be used as medicine. The chairman of the day, the keynote speaker, and panel discussants on the theme of the day we are choosing because of their unique qualifications and experience. Our chairman, the chairman of the day, the distinguished Professor Ernest Achelo, Professor of Health and Safety Education at the University of Port Harcourt, and Fellow of the Institute of Safety Professionals of Nigeria. He is a very respected academic in occupational health, health promotion, and health education. While the keynote speaker, Father Professor Walter Inhejika, He's a Reverend Father of the Catholic Church and a professor of development communication and media studies. He therefore has the unique qualification and professional experience to insightfully discuss the theme of today. The panel discussants on the theme also have very rich academic and professional experience in health promotion and communication. Dr. Doris Inria has over 35 years experience in health education, social mobilization, and program management, working in the Rivers State Ministry of Health and with the WHO and UNICEF. She retired as the Rivers State Health Educator and Coordinator for Social and Behavioral Change Communication. Professor Godia Ekenedo is a professor of health education and promotion at the University of Port Harcourt, with focus on health needs assessment and the design of health education programs. She has worked with UNICEF on school health programs and currently the Rivers State chairperson of the National Association for Health Education. Another of the discussants, Dr. Diana Babo, is a medical doctor and currently serves as a health educator with the Rivers State Primary Health Care Board. The fourth discussant, Professor Ogabieli Pauline Ohiago, is a professor of digital and strategic communication. She has a first-class degree in mass communication from the University of Nigeria and Nsukka, a master's degree in mass communication from the University of Lagos, and a PhD in communication studies from the University of Port Harcourt. She's also a Fulbright doctoral research fellow and a postdoc research fellow with the Northwest University, South Africa. I have no doubt that they will do justice to the chosen theme of day 11 of our conference. Therefore, sit back and listen to these experts. Welcome. Welcome to the day 11 of this scientific conference. So I'm sure that it was a long one, but it's just a long one, but we can. So we can move on. The next is the chairman's opening remark. The chairman's opening remark, sir. The chairman is with us, yeah. So chairman, please. Yeah, opening remark.
Thank you very much, sir. Good morning, everybody. I feel very honored to be invited as a chairperson of today's seminar, today's conference. The Vice Chancellor, University of Port Harcourt, the principal officers of the university, the Director of School of Public Health, Professor Best Odinaha, the keynote speaker of the day, Professor Walter Chiwendo Ihejirika, the panel discussants, Professor Ekenedo Golden, and Dr. Doris Enria, Dr. Diana Babu, colleagues, students, ladies and gentlemen. I feel deeply honored to be invited as the chairman of this occasion, of this conference. And you are all welcome to this, the 11th or the first annual scientific conference of the School of Public Health, University of Port Harcourt. Once again, I feel deeply honored to be the chairman of the day, and I'm very grateful to the Director of Public Health and Professor Bess Odinaha and the entire members, staff, and students of the School of Public Health. I appreciate the privilege given to me as the chairman of today's occasion. Now, the topic, the theme of today is making medicine out of health talk. This topic is very thought-provoking, to say the least. And although the topic might sound poetic, it is actually rooted in the science of public health, medicine, health promotion, health education, and communication. As we all know, the relationship between health promotion, health talk, and medicine is well known. However, the problem is that while the importance of health medicine is well known and recognized, the importance of or the role of health talk is not fully appreciated. According to the World Health Organization in 1987-86, health talks, research have shown that health talks can actually prevent disease, it can heal illnesses, and even save lives. But unfortunately, communication in form of health talks is treated as an optional add-on rather than an integral part of the healthcare delivery system. As you know, the health talks and medicine, they are all interconnected and complement each other in achieving the same goal. However, we know that health talk and medicine may have different focuses or approaches. For example, medicine is curative in nature, emphasizing diagnosis, treatment, and management of disease, while health talk is a method of health education, which is prevention-oriented, emphasizing education, prevention, behavior change, and helping people and empower people to take informed decision or intelligent decision to improve their own health. Now, okay, as I said, while I'll give example of medical issues as we go on, but it is well known that health talk can be a form of medicine, but this does not mean that health talk can be transmitted into drug or medication. And there are many research evidences, as the chairman, as the director has already mentioned, that health talks can be very powerful in disease prevention as well as healing illnesses. The only problem is not recognized as much as medicine is recognized. And finally, ladies and gentlemen, we have our keynote speaker who is a development, communication, and media study, or major study. I believe he's going to do a very good job in analyzing and dissecting and x-raying this topic, which looks very simple, but indeed is very complex. And I'm sure that it will make inputs. The lecture will help us to really understand what the concept of making medicine out of healthcare is all about. And I believe that at the end of this, we would have set a forum or a platform for a very intelligent and effective discussion. Thank you very much.
Thank you, sir. Thank you, Chairman, for that opening remark. So we can now take the Goodwin messages. I don't know if the state chairperson of the National Association of Health Education. If she's around, Professor Odia Ekenebo. Hello, ma. I'm sure she's there. I'm sure. Hello, ma. Can you unmute and then give the goodwill message of your association? I know you have other roles to play today. Hello, ma. Can you unmute? Is she identifying herself? Yeah. Hello, madam. Can you unmute yourself? You can now unmute yourself. Hello, ma. Okay. Okay. Hello, madam. You can unmute yourself and then give us the goodwill message. I'm sure that she'll be able to do that. I think we'll take the goodwill message during the panel discussion. So we can go ahead and then take the citation. Let me confirm that our keynote speaker is on call. Professor Ihejrika.
Yeah, good morning, sir.
Our Lord, spiritual and temporal. Thank you, sir.
Thank you very much.
Yes. Okay. So we can take the citation of the keynote speaker, and after that, he will give the keynote address.
Professor Walter Chikwendu Ihejirika won a unanimous vote to give the keynote address on day 11 of the first annual scientific conference of the University of Port Harcourt School of Public Health. He won the vote for being an engaging lecturer, erudite researcher, mentor, communication expert, and most especially as an ordained clergy of the Catholic Church with competence in the healing powers of words. Professor Ihejirika is an ordained priest of the Catholic Diocese of Ahịara Mbaise, Imo State. He pursued his postgraduate studies at the Pontifical Gregorian University, Rome, graduating with a master's degree in Missiology and Communication Studies and a doctorate in Communication Studies. He also holds a master's in Communication Pedagogy from the Salesian University, Rome. At the University of Port Harcourt, Professor Ihejirika has served in several leadership capacities as head of department, dean of the faculty, and director of programs at the university's radio station, Unique FM 88.5, excelling in each role. He was transformational in these positions, emphasizing competence-based education, translational research, and community service. As professor of the Department of Communication and Media Studies, his academic motto is the application of communication principles for cultural promotion and the integral development of individuals and communities. His research focuses on media, religion and culture, communication for social development, environmental protection and conflict management, as well as the role of ICT in youth culture and religious practice. He has published widely in reputable journals, supervised numerous master's and doctoral theses, and provided professional and social leadership as head of department, community chair, conference organizer, and mentor. Professor Ihejirika's international engagement includes serving as visiting research scholar with the UNESCO Chair in ICT for Sustainable Tourism at Università della Svizzera Italiana, Lugano, Switzerland. He is also a communication advisor to Paradigms, a Swiss-based organization, and contributed to the review of the 2000 ECOWAS Communication and Information Policy. He is currently the president of Sinus Africa, a global Catholic communication organization. Distinguished guests, lecturers, students, ladies and gentlemen, behold Professor Walter Chikwendu Ihejirika, Reverend Father, celebrated communicator, Professor of Development Communication and Media Studies, President of Science Africa, and keynote speaker on day 11 of the first annual scientific conference of the University of Port Harcourt School of Public Health.
Thank you very much. Professor Ihejika, you can now give your keynote lecture. Professor Ihejika, sir.
All right, thank you, sir. Sorry. Hope you're hearing me loud and clear.
Yes, sir, we can.
All right, great, thanks. Let me begin by sharing my screen first of all. Just a minute. Okay, so I do believe you can. Is my screen visible?
Yes, sir.
Hello, sir. Is my screen visible?
Yes, sir. Yes, sir.
All right, thank you. Good morning, everyone. Let me begin by expressing my deep appreciation to the director of the School of Public Health, Professor Best Odinaha, and his team for extending this invitation to me to be the keynote speaker on this 11th day of the maiden scientific conference of the School of Public Health of the university. And I would like to join him also in sending my greetings to the Vice Chancellor of our university, our digital Vice Chancellor, Professor Owunari Abraham Georgeville, and the members of the management of the university. I join him also in greeting the members of the council of the university, other principal officers, provost, acting provost, deans of faculties, directors of centers here present. I would like to join him also in thanking the chairman of today's occasion and all the panelists that will join me in exploring this topic of making medicine out of talk. And finally, I would like to send my warm greetings to all the participants, the students, and other members of the public who have joined to listen to our presentations today. So thank you so much, and I do hope we'll be able to have a very enlightening and fulfilling 11th day of this conference. As has already been indicated, the topic for our discussion is making medicine out of talk. And I have also been presented as having my feet kind of one foot on one side and one foot on the other. I'm first of all, an ordained priest, as has already been indicated, from the Catholic Diocese of Anhera. And I'm also a professor of development communication. So invariably, my presentation will have elements from both sides of my formation. But I will also focus especially on the current area of my specialization, which is development communication. And therefore, I would like to begin by recalling to us that in 2015, that the member nations of the United Nations inaugurated the Sustainable Development Goals, in which they set out 17 practical goals, which, if attained by the year 2020, will put humanity on the firm grounds of social and environmental development. The third goal of the SDG, as we know, is all about health, ensuring healthy lives and promoting well-being for all at all ages. That's the third goal of the SDG. And I would like to make the fact that, you know, the SDG, other goals cannot be attained without good health, because it is only healthy individuals who can think, work, and plan well for the future. So I want to put it on record that good health is at the center of good sustainable development. And therefore, what we are doing these days is very, very important for development, because without good health, we can't talk about development. So that's the third goal, good health and well-being. We'd like to ensure that healthy lives are promoted and at all ages we have well-being. As you can see, the SDG number 3 has a number of elements or indicators that were articulated by the World Body, and we can see about 9 of them were articulated: reducing maternal mortality, preventable deaths of children under 5, ending epidemics, especially AIDS, tuberculosis, malaria, and other tropical diseases, reducing non-communicable diseases, preventing and treatment of substance abuse, reducing road traffic and accidents, ensuring universal access to sexual and reproductive health care services, achieving universal health coverage, and reducing death from chemical pollutions. So these are the goals that are to be attained for good health to be realized. And what comes out of that, we notice, is that good health is a multidimensional nature. It has a multidimensional nature and requires multidimensional approaches towards its attainment. And so in this presentation, I would like to focus on one of the important dimensions that can help us to achieve good health, and that is communication. So I would like to explore the role of communication in the drive towards a healthy world. I'll focus especially on health communication in the digital age. And I'd like to make the point that health communication is a subset of development communication. And development communication is nothing else but the application of the means and processes of human communication towards achieving social development. So human communication involves both mass media, it involves interpersonal communication, it involves group communication. So any process of human communication that has the aim of attaining social development comes under the purview of development communication. And so healthcare and communication are mutually inclusive. And we cannot have good healthcare without good communication. And so communication is at the forefront of any effort to promote health or prevent ill health. So we can say that health communication has been in existence from the time human beings began to engage in healthcare. Because once we begin to treat people, we communicate. Once we want to offer assistance or prevent ill health, we communicate. So from the time of oral communication down to the time of mediated communication, there have always been interactions between medical personnel and their patients. Today, we live in the digital age, and therefore we would like to focus attention mainly on health communication in the digital age. We know that there have been an evolution of the digital technology. Beginning from the Web 1.0, we moved over to Web 2.0. We moved over that. Currently, we are in the Web 3.0. And each of them have different elements. In the Web 1.0, it was more like, read-only static communication. Then when we went over to the Web 2.0, it became more interactive. That was when we started having the social media. and then beginning to have all the various forms of apps and other things that enable interaction. That's Web 2.0. And currently we are in the Web 3.0, which is not only read-only, we can both read, write, and then be able to create and verify. We are now in the age of the artificial intelligence. That's one of the greatest elements in the Web 3.0 era. And the way that this era is going to evolve is still unfolding, especially with the growth of artificial intelligence. Therefore, we are trying to look at how this digital technology has impacted on health communication. There are a number of trends which have emanated from the application of digital technologies to health communication. Some of them include the fact that patients can now be reached through multi-channels. There are apps that can help patients to have self-service portals. We can use artificial intelligence to create personalized messages. There are personalized videos. We have telehealth, and then using digital technologies to secure customer information and all that. These are part of what has emanated in some of the new trends that have come into effect through the application of digital technologies. We would like to explore some of them. Then the point is that, as Potin, who said, communication landscape is shifting towards an increasingly customer-centric approach, and we continue to do so throughout 2025. So in the past, health communication was essentially a top-down model of communication where the medical personnel inform their patients the things that they have to do and the things they do not have to do. But with the digital technologies, things are changing. There is more focus on the patient. There is more focus on interaction. There is more focus on sharing. And there is more focus on the things that can be done without even medicine. Another expert noted, in 2025, the potential of artificial intelligence isn't just about producing more content. It's about creating meaningful connections. By blending the power of artificial intelligence with authentic human stories, we can deliver communication that not only informs, but truly inspires trust. So there are new forms of health communication that are now coming out, are being amplified through the digital technologies. And I would like to explore some of them briefly. The first one we can talk about is TV drama series. There are different approaches and perspectives on the application of medical TV dramas in health communication. And researchers have shown that depicting mental illness or addiction in the media can help to diminish the stigma about some of these conditions. So the use of TV series, TV dramas are being adopted and are being amplified in the digital age, because the digital age provides more opportunities to have this kind of dramas, and applying them can play a positive role in some healthcare situations, especially, as we mentioned, reducing the stigma and correcting a lot of cultural myths about some of the health situations. Another possibility that has amplified with the digital technology is televangelism. The digital technology has amplified the space in the digital television space. The digital technology has provided many religious leaders opportunity of carrying out their evangelizing mission through the media. So a good number of people now have their YouTube channels or other platforms on the digital space in which they preach their mission, different religious groups, not only Christians, but Muslims, are engaging in serious evangelizing programs through the media. And we know that one of the things that religious leaders, where they are very, very effective, is to speak to the heart of individuals. They touch the spiritual aspect of life. They can motivate people through their teaching. They can bring about change of attitudes. This is the area that most religious leaders are very, very powerful in carrying out their mission. But then there's also the other dimension, which is noticeable especially among Pentecostal and evangelical branch of Christianity. There are a lot of the preachers and pastors who are engaging in what they call healing ministries. And these healing ministries are often done not with medicines, not with physical things, but through their speech. It is true that sometimes some of them make use of materials like olive oil, holy water, but the greatest aspect of their ministries is done through their preaching and their teaching and their sometimes the touching of the people who are. Digital technology has amplified this. So we have a lot of them now that are visible, even the comedic ones, and then the ones that many comedians have turned their preachings into comedies. Easily coming to our mind is our good friend from Onitsha. What's his name now? I'll pick up his name. It just escaped me briefly. Pastor Dumeje, whom we all know a bit, who is almost becoming more popular with his comedic activities than with his religious activities. But the point is clear. Many of these religious leaders are engaging in talk that is believed to bring about healing in various dimensions of human life, not just the psychological, but also the physical. We hear about stories of those who are lame that are meant to walk, people who are suffering from different forms of infirmities that have been that have been said to have been healed through the talk of these preachers. However, we must make the point that there are contrasting views regarding the veracity of the healings. This is one of the areas of my research interest. I've carried out a lot of research in the area of televangelism. In fact, my doctoral thesis was, the title of my doctoral thesis was The Role of Televangelism in Conversion. And then I've written also papers. One of my papers on this was a critical view of the role of televangelism in social development in Nigeria. So I have seen different varying points about these issues, and there are contestations sometimes about the veracity of the healings occurring through these ministries. But a point has to be made that many have all come to testify to both physical and emotional cares that were received through the spoken words of these religious preachers. So digital technology is affording religious preachers space to speak and to heal. The other form of trend of that digital technology is amplifying is also storytelling. Storytelling as a form of health communication that can bring about healing. Like all the audience, the digital technology has empowered patients because digital technology has given the audience the power to be a key part in the communication process, not only at the receiving end, but also empowered to become co-creators of communication content. So they are no longer merely at the receiving end of the health process. Their voices can now be heard. And how are their voices heard? through their stories. Through their stories. A scholar noted, that's Moorhead noted, people who suffer from chronic diseases or disabilities, such as eating disorderly, mental health issues, and rare diseases, can share their experiences and daily lives through user-generated social media content, such as blogs or videos. By telling their experiences and therapeutic journeys, they can contribute to raising awareness of these lesser-known issues, destigmatizing these conditions, and encouraging others to seek help from healthcare professionals. Storytelling. Another way of telling stories may not be the patients themselves telling their stories, but other health professionals can also help to communicate the stories of their patients. And a good example of this is a colleague I know, Ms. Bahati Cosmos from Tanzania. She is a professional health counselor and dedicates her time to young girls in her country who suffer mental health issues deriving from past negative experiences. She listens to the stories of the patients and turns them into e-story books. Her recent book is titled Luna, and this is the introduction to the storybook. It says that the Luna is the rules from ancient, and it is more than just a story. It is a mirror to the hidden struggles many students face and a guide for healing and resilience. It tackles one of the most underestimated issues affecting young people today, and that underestimated issue is unresolved grief, which can turn into a very negative mental situation in the future. I invited Mrs. Cosmos Bahati to this. I hope she is also in the audience. Maybe at the end of my presentation, if the director, I will request the director for her to say one or two words as a living example of using talk to heal people. One or two words, maybe a minute or two, if she can say one or two things about her work. The other trend which the digital technology has enabled health communication is dedicated media channels. Digitalization of the media industry has provided wider spectrum for audio and audiovisual broadcasting, enabling specialized media channels. In the past, such specialized channels have focused on entertainment, like music, film, football, sports, and all that. But today, medical professionals are becoming media entrepreneurs and are setting up specialized media channels for health promotion and education. A good example is Save a Life radio station here in Port Harcourt, Nigeria. So these are dedicated channels that are focusing on health, talking about health, teaching about health. That's the power of the word, the power of speaking that can make a lot of difference in the health situation. The other, the last trend which I would like to look at that has been the outcome of the digital technologies is social media health influencers. So medical professionals who have created a niche for themselves in the digital space by providing instructions, information, and tips for different sectors of the health spectrum. These are those we call social media health influencers. Because they are trained medical professionals, they are able to provide accurate information about different health conditions, debunk cultural myths, correct misinformation, and disprove disinformation. They are doing this through their talking, through their words. And through this talking, they are making a lot of impact in the health sector. These are some of the top Nigeria social media health influencers currently. Among them is Dr. Zara Modibo, Her social media name is Debo Africa, and she focuses on cancer, sexual and reproductive health, and infectious diseases. The other one is Dr. Egembachin Onso Fidelis, popularly known as Aproko Doctor. He is noted for breaking down complex medical issues with humor and storytelling. He's very active on Facebook, Instagram, YouTube, and Twitter. There is also the noisy Niger pediatrician, Dr. Ayodele Rena, who educates parents and caregivers on childhood health through his noisy Niger pediatrician brand. We also have the bearded Shina, Dr. Ajidahun Olushina is an internal medicine specialist who also uses humor and skits to share health tips and debunk myths. There are many others who are health influencers who are using their channels, using their platforms to talk about health, to teach people, and to let people know the right things to do. And what they have a lot to contribute. I did a simple web analytics of Aproko Doctor. I purposefully chose to focus on Facebook because of the fact that it is more accessible to people than some other social platforms. You don't need a sophisticated mobile phone to have access to Facebook. So I also purposefully decided to focus on Dr. Egemba, that's the Aproko Doctor, who has one of the highest followings. He has more than 2 million followers on Facebook alone. He has the same number in the other platform he has. So I assessed the audience engagement with the videos he posted between the 6th to the 18th of September this year. And these are some of the results I have. Some of the videos he posted deal with issues he dealt with, health issues he talked about. And then the audience engagement. One of the videos was, if you ever see blood in these 5 places, run to the hospital. And he presented about. The video had the following engagement: 42,000 likes, 1,200 comments, 25,000 shares. Then the other one he said was, what happens to your legs if you ignore this? Don't wait to find out. Watch this. That one had also the 6,800 likes and then the other engagements. Then there was one that talked about how to grow your hairline fast. That one had 55,000 likes. Then there's the one that says, this is what bad air does to pregnant women. It also has engagement. Then there's another one that says, every girl child needs protection from cervical cancer. The easiest way is by giving her the human papilloma virus vaccine. This also has those kind of engagements, as you can see on the screen. Then one of the videos talked about anybody still using newspaper to wrap your food in 2025 is poisoning you. And it has all those engagement. Then one of the videos says how Slim Tea almost killed Tina in 7 days. So the point that comes out is, okay, every video posted has a lot of engagement from the audience, which wouldn't have come about if a Aproko Doctor has only one room in a hospital or sitting somewhere talking to a few people. We can see the large audience engagement, comments that are made. These are sample of the comments we are left on some of the videos. Emmanuel said, he is helping the society, so I love him so much. Lydia said, Aproko Doctor is a lifesaver. I highly recommend him. His platform is very educative, and it has exposed me to so many truths, as well as dangers and signs I should avoid. Franklin said, very educative and informative. Jennifer said, Aproko Doctor is one of the most educative doctors I know. I highly recommend him. Home Doctor said, Aproko is a medical doctor. He teaches about health in a comic way. His contents are very educative. So it shows that there is very good engagement with the presentations and with what the APROCO doctor is saying, just like all the other social media social media health influencers. So the point I would like to highlight here is that digital tools are helping in the enhancement of effective health communication. Because at the center of every form of human communication is the creation of shared meaning. That is the convergence of the actors in the communication process. Effective health communication means creating shared meaning between healthcare providers and recipients with the aim to influence health behaviors. So communication is not complete if there is no feedback from the receivers. The feedback confirms if there is a synergy between the intended or expected reaction and the actual reaction. In healthcare, this feedback loop is vital for patient safety and treatment efficacy. The provision of a feedback mechanism is the biggest advantage which the digital technologies have brought into health communication. The audience of the digital health influencers can easily send in their feedbacks through reactions and comments. They can ask questions, receive further teachings, express appreciation or displeasure about what is presented to them. Through the feedback, medical professionals can identify misconceptions and correct them before they affect health outcomes. So the internet is described as a World Wide Web, implying a wide space where every cultural and social interest can be accommodated. So it enables the health communicators to tailor their messages to the need of the audience, which is another important element of effective communication. The sender of a message must ensure that the messages are sent, taking cognizance of the target audience, their social conditions, their context, their age, and so on. So with the digital technologies, we can now have messages that are tailored to the needs of the specific audience. This makes for more effective communication. The use of the digital technologies also make it possible for the audience to revisit the information over time. Repetition is a very important condition for for effective communication, because we may not understand something very well at the first instance, but when it is repeated, when we can go back to look at them, we may gain further knowledge and it will enhance the effectiveness of the communication. So the consistent messaging across different touch points reinforces learning and increases the likelihood of behavior change. So all that we have pointed out is that the use of these digital tools in various ways are amplifying effective health, which results in behavioral change, patients able to follow the treatment and recommendations, knowledge retention, reduced anxiety. This is one of the areas, especially as we talked about, the televangelists are helping. The soothing words of the televangelist, the promotion of hope, which is a very important element in the life of human beings. If there is no hope, life becomes difficult. But when you provide hope to people, it reduces anxiety and can bring about greater comfort and confidence to move forward to the future. Effective health communication means that appropriate health-seeking behaviors are in place. And finally, effective health communication brings about improved health outcomes. And those improved health outcomes are measurable improvement in clinical indicators. We must be able to measure and be able to affirm that the outcomes are really real. They are very, very verifiable. So this is what effective health communication brings about. And this is what the digital technologies are helping various actors to achieve. We now come to the last part of our presentation, and that's the conclusion. And the logical conclusion which can be drawn from our presentation is that communication is as important as the medicines which are prescribed to patients. The substances that are prescribed to patients are the medicine in various forms they are, but the thoughts that are carried out in the different ways we have highlighted are also like medicine. They heal people in various ways. They can heal psychologically and physically. They can bring about expected changes. And therefore, we make bold to say that effective communication means making medicine out of talk. Without effective communication, it will be impossible, and I would like to repeat that. Without effective health communication, it will be impossible to achieve the set goals of the Sustainable Development Goals, number 3. Because without communication, we'll not be able to let people know what to be done. Industries will manufacture the best medicines, but we can't explain it to people properly. Medical doctors may make inventions through their researches, and scientists can make all this research, all the findings they like. But if they are not well communicated, they will be of no use. And therefore, effective communication is indispensable. It means making medicine out of talk. And so based on this, our conclusion, we would like to recommend the following. While we commend the efforts of health professionals who are engaging with digital technologies to promote good health knowledge and practice, it is recommended that more talented health professionals also engage with digital technologies for better health outcomes. More and more. The digital space is called the World Wide Web. We use the sea, ocean. It's like an open ocean. That's why we talk about navigating the web. And because it's a wide ocean, we cannot fill it up. There are a lot that can still be done. There are spaces that need still to be filled up. And the more, the merrier. So we are calling on professional health health professionals who have the communication talent to become more and more engaged in social media. The second recommendation we would like to make, we derive from the fact of the situation, current situation between physicians and patients. Padilla and his companions noted that the physician-patient relationship has changed throughout history as the role of the physician has been transformed. This relationship has evolved from a paternalistic model to a cooperative, deliberative one, presenting a meeting between two experts, the physician as the medical expert and the patient as the expert on himself or herself. And based on this, it is recommended that every medical professional should be acquainted with the basic skills of effective communication. In many countries of Europe, the teaching of basic interpersonal communication skills has become a mandatory element in the curriculum of colleges of health sciences. And so we would like to highly recommend this to the Nigerian system. Health communication should not be only for public health training, but an indispensable element in all sectors of the colleges of health sciences. And finally, I would like to come to the area where I am also very well implicated. That's in the area of televangelism, healing with words, healing through talks in the practical sense. We also would like to recommend some form of moderation, because we know that the digital technologies have provided everybody the opportunity of coming on air. And so anybody who has the possibility can set up a channel and claim to be a spiritual or religious healer. Anybody who has the possibility can come and make the claim of receiving or making testimony of receiving healing through a religious healer. Now, sometimes the issue is that some of these testimonies cannot be scientifically verified. And therefore, it is easy for people may be carried away with some of these. And sometimes it may lead people to be jumping from pillar to post, looking for healing. When you hear that a particular pastor is a healer, we all flow there. Then tomorrow another one comes up. So there's need for some kind of moderation so that people may not be deceived by some charlatans who claim to be spiritual or religious healers. A lot of times people have been deceived. Instead of matching the medical experts with the religious, they follow only the religious people who are not trained, who are charlatans, believe in them. And sometimes it had led to unnecessary death. People have not gone to hospital when they should because a pastor or a religious leader told them not to. People may be in a very bad situation of health, and the pastor or a religious person asks them to go on fasting when that fasting is not suitable for their health. And sometimes these have led to very, very unpalatable outcome. And that is why we say, inasmuch as we commend and believe that religious talk can bring about healing, both physical and psychological and emotional, but without moderation, it can bring about greater harm than good. And so I believe that with these few recommendations and the expositions that we have made, that we all begin to take health communication very, very seriously and make it an integral part of our health system, because we can make medicines out of talk. Thank you very much.
Thank you. What an inspiring lecture. Please, can we just give him a standing ovation? Thank you very much, Professor Father Walter Ihejirika, for this wonderful lecture. I'm sure that we have learned a lot, and we can, with your permission, let us adopt it as one of the teaching materials of our school. Thank you very much, sir.
Thank you.
We can now sit down. I don't know, you made mention of someone that
yes.
If we can identify her.
Okay, Bahati, if you're online, please let us know.
Can you, if she can raise her digital hand for us to. Has she done that?
Okay, I think has she?
Okay, we know that it will be nice to know. In fact, you have provided such a wonderful insight into this, and of course, this internet thing. I think that is what all of us should even begin to think about. Thank you very much, sir. I'm sure that you will also be with us for the panel, during the panel discussions, which we are going to go into after a short cultural display. Sorry, are we? Sorry? She's there? Okay. I understand that the Rivers State chairperson of National Association of Health Education, Professor Godia Ekenebo, she's here, and she will probably, I think we can have her comments before before the brief cultural display. Can we? Hello, Ma. Can you indicate, and then so that if you can unmute. Okay, Ma. Can you go on with your goodwill message? I must state that this is your capacity as the state chairperson of Nigerian Association of Health Education. Hello, Ma. Can you go ahead?
Yes.
Okay.
Thank you. Thank you, the Honorable Director of UNIPORT School of Public Health. And having established the protocol earlier, I want to everyone. It's a real joy for me on behalf of the greetings at this important gathering. And what a brilliant theme you have chosen for today's discussion, making medicine out of health talk. It resonates deeply with all of us who have dedicated our lives to public health education. Truly, this theme could not have come at a better time. As health educators, we know that words are powerful. Health talk is more than a conversation. It is prevention. It is empowerment. And in so many ways, medicine. When properly communicated, health messages can save lives, changing behaviors and strengthening communities. From immunization campaigns to nutrition education, from mental health awareness to preventive screenings, the words we share have potential to heal far beyond the walls of the hospital. Every time we share knowledge, we are offering a form of medicine, one that is affordable, accessible, and available to all. I commend the School of Public Health indeed for putting this conversation at the center of today's discussion and creating the platform where scholars, practitioners, and students can explore how effective communication can translate into action and action into health outcomes. This theme reminds us that the future of health depends not just on laboratories and hospitals, but also on classrooms, communities, workplaces, and the everyday words that we share. It reminds us that education is not an accessory to healthcare, but it is its foundation. As an association, we stand ready to support health promotion initiatives, to amplify health messages, and to collaborate with organizations and institutions in shaping a healthier future for our nation. Let us continue to bridge the gap between knowledge and practice so that every health talk becomes a dose of medicine and every educated community becomes a healthier community. I wish the organizers, participants, and partners a fruitful, inspiring conference. May our discussion here today ignite ideas that will ripple across communities, improve lives, and shaping the future of health education, not only in Nigeria, but globally. I want to appreciate the keynote speaker for the wonderful insights into digital health education, which is where the world is going and where the world is presently. It is very insightful, and I hope that we are going to have a robust discussion around this thing today. Thank you, and God bless you.
Thank you, Ma. Thank you for that wonderful goodwill message. So we'll take a short break down and enjoy some cultural displays. And when we come back, we'll we'll start with the panel discussion, and the panel discussion will be on the theme, making medicine out of health talk. And we have 4 panelists, Dr. Doris Nria, a retired health communicator with over 35 years experience in health education, social mobilization, and program management. Has worked with the Rivers State Ministry of Health, the WHO, and UNICEF. And then we also have the Godia Kenido, the chairperson of Nigerian Association of Health Education, a professor of health education and promotion, and then Dr. Diana Babo, the currently serves as health educator with the Rivers State Primary Care Board, and then Professor Obiagbeli Ohiago, a professor of digital and strategic communication, and a first-class degree holder in mass communication. So when we come back after the cultural display, we'll start the panel discussion. And we are coming back by 11:55. That is 5 minutes to the panel discussion. Okay, I hope you can hear me now. So let's be sure that we have the panelists with us. Dr. Doris Nria. Hello, ma. Hello, ma.
Yes, sir. Good.
Dr. Doris.
Yes, sir, I'm here.
Hello, ma.
Hello.
I'm sure that.
Good morning, sir. Good morning, Prof. I'm here.
I don't know if.
Are you hearing me?
Yes, ma. Yes, ma. Good to know that you are here with us.
Yes, I'm here.
Okay. Dr. Godia Ekenedo. I'm sure that she's here because she just spoke with us. Hello, ma.
Yes, I'm here.
Okay. And then Diana Bagbo, I think she said she's on transit from Abuja. I don't know if she will be able to join us. Sorry? Diana Bagbo. Okay. Then Professor Obi Ohiago. Hello, ma. Hello, Professor Obi. Hello, ma. Professor Ohiago, hello, ma. Is she? I'm sure she's Obi Pauline Ohiago. Eh? Okay, well, I'm sure that okay. Please, Prof. Obi Ohiago, you can raise your hand so that you can be identified. Thank you very much. I'm sure that that will be sorted out. So as is usual, we'll go around the the panel discussants for their opening remarks before we go into the question and answer section. Let me also say that we will also call upon the chairman and the keynote speaker to also make one or two inputs, perhaps at the end of the discussion. Thank you very much. So we can call on the panel discussants for their opening remarks. Let's start with Dr. Doris Nria. Let me remind you, Dr. Doris Nria retired as the River State Health Educator with over 35 years experience in health education, social communication, and project management. Of course, she worked in the Rivers State Ministry of Health, but also collaborated in several WHO and UNICEF programs. In fact, she was the state educator during the COVID-19 pandemic. Very experienced lady. Hello, Dr. Onria, can you go ahead and give us your opening remarks?
Thank you very much, sir. Good morning, able chairman of today's conference, very distinguished senior colleagues.
Frozen? I don't know if it's our network or her own. Huh? Is it our network? Our own. Okay. Can you take off her video? Let's see if that will make it better. Okay. It seems the network struck at the wrong time. So we can go to our chairperson. Hello, Prof. Ekenedo. Hello, ma.
Yes, Prof, I'm here.
Okay, can you make your opening remark about this one on the team, not as a panelist, but not the chairperson of the National Association of Health Education?
Okay, thank you, Prof, and greetings once more to everyone. Indeed, I'm so glad to be here and to be part of this discussion. I want to once more thank the keynote speaker for giving us a background on the theme, Making Medicine Out of Health Talk. I want to say that health talk, like the chairman said, is just a part of health education. And health education, as we know it, operates both as curative medicine and preventive medicine. So it operates as curative medicine when we use it to help people who are already sick to receive healing. Part of what the keynote speaker said or emphasized was the role talk plays in ministerial healing for those who are in the religious ministries. So sometimes the healing can be temporary, it can be permanent. Health education also functions in all the 3-4 levels of prevention, disease prevention. So it functions at the primary level to provide knowledge and skills that people require to engage in the right behavior in order to prevent the onset of diseases. Can be used in various settings and at various times. During epidemics, can be used. Can also be used at various settings like the school, the community, workplaces, and IDPs, and various other settings where individuals gather. So it can be used both as a primary prevention. At the secondary prevention level, health education helps individuals to understand how a disease can be managed, how to adhere to medical instructions. And it also helps people to understand the importance of early detection of diseases. Then at the tertiary level, health education helps patients to understand the role of rehabilitation in bringing them back to normalcy, or at least to function well in the society, to take care of complications of some diseases, and also to help them prevent a reoccurrence, a recurrence of a disease. So the role of health education in medicine is invaluable. And
thank you.
We know that every health practitioner requires this skill in order to, function properly in his or her own area. Thank you so much.
Thank you very much, Chairperson. Thank you very much. I don't know if we can go back to Dr. Andrea. Hello, ma. Oh, she's not yet back? Huh? Okay, so we can we'll continue with our chairperson. Thank you very much, Ma, for that discussion. I know you have a lot of expertise in school health. Is it? We have a lot of, we have the students, and in fact, even all of us. Is it? Can you help us with probably? Can you help us stress the importance of school health programs, especially the health education aspect? Or what can we use? How can we? What are the roles of health education in ensuring in school health?
Okay. The school health policy emphasized actually skill-based health education. So not just health education.
Okay, skill-based.
Skill-based health education. So it's not just in providing information, but providing the skills needed in putting the knowledge acquired into practice.
Yes.
It's a very important component of the school health program.
Yeah.
And of course, is a pivotal to the other components. So the school health education provides basic information on different areas of health that the pupils, students, and their staff are supposed to know, that will help them to protect the health of the school children and help them to become responsible members of the society and contributing to the global health of the community. Because when children are well informed, they will grow up into adults that are health literate. They also take home information to the homes and to the community.
Yeah. Thank you very much. I think I like the fact that you stress the fact that it's skill-based. Skill-based.
We've seen many times where children try to correct their parents. Yes. Or the fact that if you are, for instance, teaching children the importance of hand washing, you should be able to demonstrate hand washing, let them do it, and understand that every hand washing is not hand washing. There is a proper way of washing hand.
Thank you.
Okay.
Thank you, Ma. I think I actually like the fact that you stress that health education has, especially in the school health, as a component of the school health program, emphasizes is skill-based, which means it's not just the usual thing that it's not like the usual lessons they give in these schools, but the emphasis is to let them learn the competencies involved in carrying out those healthy behaviors. Thank you very much, Ma. Thank you. Let's we'll come back to you later, Ma. I don't know if Dr. Ria is back. Okay, thank you very much. So luckily we have Professor Achalo and our keynote speaker, Professor Ihejirika. Hello, sir.
Yes,
you
delivered
a very inspiring lecture.
Okay, sir. Thank you very much.
The one that and the good thing is that we have both the slides and the audio, so we can play it. In fact, we even develop it into a podcast, so that
Wow, thank
we
you.
can listen it everywhere. I just, you know, I was just saying. Anyway, let me just ask you a question that is probably you can even answer with your other career. I don't know, why is it that miracles in the Catholic Church, they are not as plentiful as those of the Pentecostals?
Well, okay, well,
That is miracles in quotes. Let me just put it in
in
quotes.
quotes, yes, yes, yeah. Because now, first point about it is that we believe in miracles in the church, in the Catholic Church, because as we know, Christianity derives from the teaching of Jesus Christ.
Yes.
And we believe that Jesus Christ is a historical being. He's God. He came and assumed the form and nature of man and lived within a certain historical period and performed miracles as a way of helping people to believe in him and his mission. So right from time, we have always preached about miracles, but we also preach it in the Jesus way. There's a slight difference between miracles as being postulated today and the Catholic belief on miracles. Now, if you look at Jesus, when he performed miracles, there's always a verification process.
Yes.
I give an instance. There was the time when Jesus Christ healed a blind man.
Yeah.
And people who knew him said, "Is this not the man who was born blind?" That means people knew his before and the after. So there's a form of scientific element in the miracle. So miracle is not because, let me digress a bit. The Catholic Church, we believe that there's a synergy between faith and reason.
Yeah.
You know, and we believe that faith without reason becomes superstition.
Yeah.
And reason without faith leads to nothing. So we believe in the synergy between faith and reason. And that means even in miracles, an element of reason has to follow. It's not just enough to say somebody has been healed.
Yeah.
Without any verification process.
Yeah.
Now, in the Catholic Church, one of the things that makes us to canonize somebody as a saint is that miracles have to be performed through the intercession of that person.
Yeah.
And that miracle has to be verified through a process. Somebody was born with a congenital health condition, already verified by medical doctors. And the person believed that through the intercession of this saint, I am healed. And the doctors will come again to confirm that this is so. So there must be an element of verification. So it's not just enough for somebody to come out and say, I received this, I was cured, I was lame, I was this. That's the point I was talking about moderation. There must be some element of verification. If somebody says, I have been healed, there must be some verification. Otherwise, we'll be peddling lies in the name of religion, which is not good. And that's the reason why,
Thank you very much. I once read that in the Roman Catholic Church, there's actually a committee of distinguished medical practitioners that verifies miracles before they will be accepted.
Yes. Let me make another point, sir, which is also very important. Now, the second point that may be also important is that we believe that God also has given human beings capacities and abilities. And those are to be used for good. Now, it's not everything that we consider to be miracles. That I'm having a headache means that I need to approach, there are medical experts that can give me headache, Panadol. God gave them the capacity to manufacture Panadol and they can cure. So if I take that drug, I will be healed. So we must have also that consciousness that there are certain aspects that have to be treated with medical intervention. It's not everything that should be treated from a spiritual point of view. Some health situations must require the attention of medical experts and must not be treated from a spiritual point of view.
Thank you very much. You know, as a communication expert, I know that I'm sure that you know one or two things about persuasion.
Yes.
Yes, because in Nigeria, we are in the health sector, we are finding it difficult to convince even political office holders to budget the required amount of funds for in the for the provision of healthcare. Do you think that we need to? Can you give us one or two tips on how to convince these political leaders and even persons, rich individuals, to make money available for health programs? Any tip on persuasion?
Okay. No, the point about it is that this is also part of development communication. Now, development communication means about doing everything within our power to provide for the well-being of the individuals and the environment. Unfortunately, the reason why we consider our country and nation as still underdeveloped is basically from the point of view that the number of things that ought to be put in place are not being done by those in leadership, simply because they have alternatives. They have alternatives that enable them to go for medical tourism outside the country. Even when they have simple headache, they can go to UK, America, or India. But the poor masses are not, because of that, because they have alternatives for themselves and their families, they are not being very careful and concerned about what is going on. How do we go about it? That is part of what we mean citizen enlightenment. First of all, we must enlighten our citizens to know that they are the ones to push for this. There is not the major persuasion is about citizens rising up to their feet to demand for their rights. Unless citizens are able to make those in leadership positions to know that the situation is not good, they will continue to profit from it. And unfortunately, the context we are living in Nigeria today is that we have a kind of passive citizenry, So what everybody is just concerned with the day-to-day, just hand to mouth. So the persuasive element must be citizens must become alive to their responsibility, which means standing up to let those in leadership live up to their responsibility. When they come to look for votes, they made promises. But when the time comes to deliver, they don't. It's our right and the responsibility. Every sector, the religious bodies, the press, and every sector of the society must stand up together and seek for the rights of the citizens of the country.
Thank you very much, sir. I must say that you are speaking. Your library is well stocked with books. I know several hard copies, but I know that there are even much more that are electronic.
We are now more of the e-library.
Yes. Let me also commend the quality of your internet connection.
Thank you, sir.
Thank you, sir. Thank you very much, sir. Well, we may come back to you later, but I understand that Doris is around. Hello, ma.
Yes, I'm very much here, sir. My internet just locked me out.
Don't worry. I was just okay. It's all right. Can you give your opening remarks? Make your opening remarks. Then we can move on.
Thank you very much, sir. Thank you. As I was saying, I said the only place where people don't interact is in the graveyard. So communication is very, very important. You want to talk to your patient, you need to communicate. A situation where we have a lot of patients to one doctor or to a health worker has affected the way the health worker need to communicate with their patients, because you want to meet up the number of patients that you will see for the day. You don't care to ask certain questions. So you just look at the person, you prescribe the drugs, and the person goes. What if the person, let's say a woman that is battered and is coming with some issues, you just prescribe it. So communication is very, very important. And I think this meeting affords us that opportunity to interact and to carry the message back to give to those that are not opportune to be here, so that we all work as a team and make sure we reach the understanding. Those that don't have that opportunity, so that they will know the importance of opening up and equally sharing experiences and sharing and increasing demand for health services. Thank you very much.
Okay, ma. Thank you very much, ma. You while in service, you were the coordinator for social and behavioral change. I'm sure that you were involved in the efforts against the campaigns against harmful traditional practices.
Very correct, sir.
Well, will you be willing to just share some of your experiences with us?
Thank you very much, sir. We are talking about medicine out of making medicine out of talk. It is just a way of saying that it is important to share our concerns through conversation, dialogue, and communication. And not only that, let's let us understand that behavior is built. And the people we are talking to are people who have formed their behaviors already. Their characters have been formed. So our people will say that it is difficult to tell an old woman that to use this right hand, who is used to using left hand. It is difficult. But with communication, using diverse means to reach out to this person, letting the person know the importance of now changing from that particular attitude, from that particular behavior, makes the difference. That is where social behavioral change comes in.
Yeah.
So we ourselves most of the time, when we go to church, we listen to preaching. But why is it that wickedness, why is it that social vices is in the increase? Because people just go, they listen, but they don't put it into practice.
Yeah.
So my years of working as advocacy, social mobilization, and communication in the ministry, and my interaction in the field as SBC consultant, have come to understand that a lot of people carry out behaviors, are resistance to change because of competing values, myths and misconceptions, their religious beliefs, their cultural dimensions. That is what they hold on to. So if we are to persuade them, to lobby them, which is not, we do it most of the time in the field, we need to understand our audience.
Yes.
Who are we talking to? What channel of discussion is best to use at that time?
Yes.
We are talking about digital. Yes, it's very important in this particular era. But look at the people at home. Do they have the means? Is there electricity to power their system? When do they travel? The level of illiteracy. These are the things that will keep somebody back, even after talking. Nothing will be done. So it is very important. There was a case of a woman where we talk about female genital cutting. They will tell you in your culture, for a child to be accepted in the community, the woman, the mother, must undergo that practice. Not minding the effects it will have on the woman. When you talk about exclusive breastfeeding, our grandmothers will tell you they gave water to their children. So you can't tell them to stop giving water to their children. So these are things that you need to know who you are talking to. You are talking to the individual. You're equally communicating with those influencers around that particular individual, the mother, the peer groups, the friends. Then you look at the larger society, the community. I'm happy somebody representing the institution is here, our schools, the churches, our religious bodies. Then you talk about the society as large. What is the policy backing these things that we are talking? I remember in the system when we are talking about maternal and new child health, there is budget for that. But when it comes to family planning, there was no budget. It took us a lot of effort to be able to get it through, because we are able to obtain data. Data driven is one thing. In communication, most times we don't look at aspect of data. Data is very important. When we want to talk to our stakeholders, we need to use data as evidence to convince them that this is what we need. These are the number of women that have died as a result of poor infrastructure. These are women that are not able to access healthcare. And don't forget, there are a lot of complexities people don't value because they are not sick. What is the need of taking my child to the health facility when the child is not sick?
Yeah.
The Bible says, none in my family will be sick. So I
Yeah.
believe in that. It works. So we have
Yeah.
confronted a lot of these churches, we have talked to them, and of course, the effect of the GO will not work for its members.
Yeah.
So it's individual race. So we begin to tell them, if your child has polio today, it is not the child of the GO.
Yeah.
So vaccine is available, it is free, why not make use of it? So these are some of the issues that we are facing. Then accessibility, convenience. Most
Yeah.
of the time our facilities are very far from the people. When you think of going the miles you will take to get to access services, you prefer
Yeah.
to use ones that are available to you.
Yeah.
So these
Th-
are some of the issues that
Thank
we
you. You know, you have such a rich experience, and we have to
thank
even
you.
thank the internet connection for letting you for letting us have benefit of this year experience. They used. I think you also mentioned the fact that some of the religious beliefs. If you say that a disease is not your portion, you are not likely to go for screening. And unfortunately, if the person has to pray not to have a cancer, because anybody that has a cancer that is not detected early, that person is dead, completely dead. Thank you very much, madam. I think we may come back to you later, but I'm sure that we have, do we have Obi, Professor Obi Ahiago? Hello, ma. Is she there? Okay, not yet. Okay, the chairman will give the closing. You make your closing remark at the end of the whole thing, so we can start. We can continue the interaction. So we can. Perhaps the chairperson can help us say some of these things. Probably take one or two questions I have reserved for. I reserved for um, Professor Hiago. Hello, Godia. Ekenedo. Ekenedo. Hello, ma. Are you
Yes,
still there?
I'm here. I'm here, Prof.
Yes. I know that this what they call the infodemic is very, very common, where you have a lot of should I say fake news being pardoned. Is there any way of dealing with that? What are the ways you think we can tackle those fake news?
Okay, thank you for that question. You know, when the keynote presenter was doing his job, he presented us with a lot of online influencers, online health influencers.
Yes.
And that was good. But I was talking to myself, I was saying, for one of these health influencers, we have like thousands who are dishing out unhealthy information, misinforming, disinforming. And it came to my mind that it's very necessary for health professionals to have competence in ICT so that the number of people who do this online health education can increase. The problem of infodemics is unprecedented, especially in Nigeria. People peddle a lot of, I don't know if there's no regulation, and people peddle all manner of health information on the social media. And there is need for regulation. I wouldn't know how that will happen. If there's any advocacy that can make that happen, I think I'll be in support of that. So if we are training our students, to go out there and not just look for government employment. Get yourself employed. Learn technical digital skills and engage in podcast, what do you call them, TikTok, whatever, yes. And, neutralize what is pouring out there as, misinformation, health misinformation. It's very necessary. So that is a very important area that institutions should pay attention to. Let's the students we are training be equipped with ICT competency so that many of them can take up responsibility in the social media to provide the right information and disabuse people's mind from the unhealthy information flying about the social media.
Okay, thank you very much, Rema. Thank you very much. I understand that the person that Professor Ihejirika was talking about is around. Is on call. Can you unmute her so that she can make her contributions? Hello, ma.
Hello.
Hello, ma.
Hello.
Okay.
Yeah,
welcome,
morning.
ma. Welcome, ma. Can you talk to us?
Yeah.
Yes.
Yeah. So thank you so much. Start my video later. Okay. Yeah. Thank you so much, dear Father Walter, and thank you very much for the informative and affirmative presentation. And I'm truly honored to have the opportunity to speak on this significant conference, which focuses on public health education, a cause that has profoundly shaped my sense of purpose. And ladies and gentlemen, esteemed colleague and dear participant, I extend my warm good morning to all of you. So my name is Bahati Mandago, an entrepreneur and author based in Dar es Salaam, Tanzania. I founded a wellness company in 2023, which focused on three main areas: public health education, especially mental health, advocacy and research. And our primary client often is corporate, educational institutes, and peer groups. Yeah. So this idea to start this company, wellness company, was born after realizing the global crisis on mental health. And I come to learn that was not a family crisis as I thought before. And so I come to realize that a lot of people die in silence. Companies also die or remain stagnant, or students fail to unleash their full potential. Hence, there is a solution. So I also realize there's a huge service gap. For instance, in Tanzania, we don't have more than 50 clinical psychologists. So and we are 66 million. So a population of 66 million with a very few clinical psychologists who can just have an overall picture. So I also realized the service is highly needed, but also I realized knowledge gap on the mental health is very minimal. There's a lot of stigma and ignorance. So I formed a company called Intercontinental Wellbeing. I'll provide my website below. But also as an author, I have written more than 5 unpublished books, both in English and Swahili. But so far I've published the one titled Luna, The Rose from the Ancient City, which Father Walter highlighted that. And I choose to write that book or many books because I came to learn mental health topics are better understood when communicated in a simple and relatable way. Otherwise, every effort to address issues often of a mental health meet resistance and always serious backlash. A lot of people say, oh, yeah, people are very depressed. They detach as if they are not people, as if they are alien living from different planets. But when you talk you write or you speak as a story, a lot of people are drawn into listening, and there's a lot of aha moment. So back to Luna, I received a very, very, very positive feedback after I wrote the book Luna. And Luna obviously has it speaks about depression and there's a touch of alcoholism, but the overall is about a child who is grieving, yet they do not have a support. And this is a child who has a full potential to become that whoever they want to be, but because of unaddressed grief, they almost lost their future. So I wrote Luna, and the impact was very, very good after I learned that a lot of people would accept story rather than going straight away and say, hey, I'm talking about schizophrenia, I'm talking about bipolar, I'm talking about, whatever that you can name it, or around the mental health, I'm talking about borderline or something like that. So I said, you know what, but writing stories is not good enough. I also need to reach mass media. So I thought at the moment, as Father Walter tapped on the how digital platform can be very, very powerful as long as that you use a positive message. I said I could combine the power of literature and the power of technology to make sure that I also reach a mass audience. So yeah, this is just briefly to say about why I've written the Luna. So the Luna is a story about a 16 years old child, a girl who was doing very well from her childhood in school performance, at home and everything, but her grades started to decline, and eventually she opted to drop out of school. But it was very difficult for Luna now to go back to school after a long time of struggle trying to see how best they could help Luna, but eventually Luna managed to go back to school. But this Luna is a reflection of many young girls, many young boys whose dreams are cut short because of grief or any other issues that are left untapped. You see, so Luna is a must-read book. It's a very, very nice book. It's suitable for students, suitable for parents and teachers. The whole school ecosystem, educational ecosystem, it's very, very critical for that, even for decision makers, because also through Luna, we need also to have policy changes. We need to have a legal framework reviewed, to make sure we include the counseling component in our educational institute to help people like Luna. So I will provide my website for my company, which is called Intercontinental Wellbeing Service, and I'm selling Luna on a digital platform, existing digital platform that it's called Shule Direct. Okay. So with Shule Direct, it's a platform with more than 100 schools in Tanzania and 4,000 subscribers. But might not be very user-friendly for you, but you can still try to check on a Get Value. I'll send also the link below. And my company website, I'll also send the link below. It's called the Intercontinental Wellbeing Services. So thank you so much for this platform again. Yeah.
Thank you for sharing. Thank you for sharing. And I think we'll get in touch. We have also noted the website, and we'll keep on the communication. Thank you and well done. Thank you for what you are doing. I'm sure that is going to go beyond Tanzania to places like Nigeria. It is already
beyond Tanzania. Thank you.
So to Nigeria, so that we'll be able to benefit the Intercontinental. And the company is appropriately named Intercontinental.
Yes.
So which means that it wasn't designed for just those in Tanzania, but
no.
Those in Africa and even the whole world. Thank you very much. Thank you very much. And even for being able to get out to talk. At times they just bottle up. I refuse to talk. I refuse to confide to anybody, including close friends and peers. Thank you very much, ma. Thank you for what you do. Yes.
Thank you.
I'm sure that the recording angels, they have also taken notes. While we have also taken notes on it. Thank you very much, ma. So okay, we have Professor Obiago. I don't know. Perhaps I'm not even pronouncing her name well.
It's okay. Bahati Mandavo. It's okay.
Okay. Sorry. Okay. Thank you very much, man. So, Professor Ihejika, are you still around?
Yes, I am. Okay.
Apologies. Let me. I think I was talking about, you have a lot of expertise in this internet, social media, and so. Is there any tip on how to make a viral video? If we create a message, want that health message to be seen by as many persons as possible. You have done some studies. Is there any tip, any recipe that you want to share with us before we call the guest, the chairman to close us?
Okay. Well, the internet, as we know also, depends on human capacities and abilities and human talents. Now, the first point about creating a viral video is to create a good video. That's the first point. Just like every media content, sometimes the modality of creating a video counts. The modality counts is true. A number of times the media is negative news that draw more attention. That's always the mantra. In journalism, there's always the saying that if it bleeds, it leads. That means headlines are mostly negative news. So a lot of time, negative news are what lead. And even on the internet and the social media, it's always when you put up anything of a scandal, you don't need to stress yourself. On its own, it will go viral if you bring out any such issues. But sometimes good messages like healthcare messages are sometimes difficult to go viral, just like news that are neutral and that are good. So how do we make such news to go viral? Number one, I have pointed about the social media influencers. One of the roles of media influencers is because they have a large following. Many of us have our Facebook accounts. Many of us have our Twitter, Instagram, and so on. We may not have so many followers on us. So whatever we put may not be as viral as some other ones. So the first point I would recommend is to make use of social media influencers. In this case, we are talking about, there's a difference between social media influencers and social health media influencers. We are talking about the social media health media influencers are health professionals who are also capable of communicating. They communicate with different means. We saw how somebody like that Proco doctor we talked about uses humor, relatable things for the audience he is dealing with. And that is why his videos go viral. Whatever he posts has a higher reach. So the point is that it's not about the content, the message, but how the message is packaged. So the first point of going viral is about packaging. Packaging means you have to identify your primary key audience, know how they use the media, know the kind of things they like. The young people today, there are certain things like, the comedians, they follow them so well. And this is what Proco and these other ones do. So we know how to package the message and then try to put it in a platform where we can have large following and then make use of these social media influencers that can help us to spread it. These for me are ways of going viral with messages.
Thank you very much, sir. Thank you very much, sir.
Thank you.
We are experts in health communication generally. We are just I once heard about this the use of threats and rewards in some of these things. Like those of us that are not will go to bus stations and we hear these medicine people advertise their products. It seems they use some threats. Like if you don't treat your staff, you go talk to HIV. And the other thing too, for women, I noticed that anything that has to do with the ability to fertility, if they threaten them that even minor symptoms can affect the ability to bear children, then they usually get a response. They usually get a response.
That is very true. But we know also that unfortunately sometimes, charlatans hop into that. And then non-professionals also get into that. So most of them times they are using these threats in order to get people to be convinced. But the question then is what they are saying, is it really correct? That is why we are very, very slow in propagating those unprofessional health influencers or health communicators, because most of them are saying, look at one of the key areas today is about dieting. Everybody is concerned about what we eat. So today, somebody will come and tell you, combine this and this, and you do this. Now we are talking, the other area is about fertility, for instance, you know. People are now, those who are unable to conceive, men having low sperm and all that. People come out with different recipes. Some of them may not be correct. Sometimes it has to do with the issue of now everybody is about blood pressure, sugar level, all those major health concerns of today. There are a lot of unprofessional people giving advices and recipes that may not count. So we have to emphasize on professionals. And that is why I love what one of the panelists said about encouraging students of public health and health. Create a niche for yourself. You don't need to be everything. It may be only for giving proper advice on one aspect of health. And you know, so the more we have professionals dealing with some of these health issues, the more effective it will become.
Thank you very much. Sorry, sir. Before we close, yes, pardon me. You know, at times, anyway, I think it has to do with the doctrine. I know that it's not a problem in the Roman Catholic Church. And then, of course, my own church, I'm an Anglican. You know, when people say that a disease is not their portion. And we know that non-communicable diseases, they are not like malaria, that if you have malaria, you can be treated and you get well. Cancers and diabetes, all these non-communicable diseases, and their prevalence, they are increasing. In fact, some people did it, so like in the Gulf countries, the prevalence of diabetes is more than 25% amongst the adults, which means 1 in 4 adults in UAE has diabetes. So if people have that mentality that this disease is not their portion, they will not go for screening. Will it be? I personally feel that it is probably appropriate to threaten them with the possibility, because we know that if people don't go for screening, annual medical checkup, and they don't go for screening, if they have a cancer, because cancers will not present with symptoms. When they present with symptoms, it's already too late. It's already too late. When they present with symptoms, it's already too late. So will it be, I feel, that is my personal opinion, that in this case now, there's probably a need to threaten them into going for screening.
Okay. So the point you're making is quite clear, sir. And that's one of the points also I make at every given occasion. Like I told you, I've written and researched on the pros and cons on televangelism and the healing ministries and the neo-Pentecostal theology, what we call the prosperity Christian theology, which harps upon material benefits, and then the fact, we consider most of the elements of the prosperity theology to be erroneous, and one aspect of it is what you are just mentioning. It's erroneous for any religious preacher to help to let people know sickness is not my portion, death is not my portion, and all that. Those are platitudes that are not realistic. Because it's somehow, if I come at the beginning of the year and I say no one will die in your family, no death, no cry, they are unrealistic. We believe that this world is imperfect. And so long as we are living in an imperfect world, there will be negatives. And part of those negatives are illness and death. So they are realities, they are given. We can't wish them away. And I made a point also that God gave us human capacities for different things. And part of that capacity is to cure ailment. The only time we will have a perfect condition is when we get to heaven. And that's our belief, that one day we'll get there and that will be where perfection will be manifested. So anybody making those assertions are not being realistic. And anybody who believes in those things anybody who believes in that is being misled. Every one of us, death is our portion because we inherited it, and one day we will die. But the only difference is that we believe that life does not finish at death. There is still life after death. Anybody who says that sickness is not my portion is being misled, because at one point we may have one form of sickness or the other. But the only thing we know is that God can give us the capacity through other human beings to cure our ailment. Then, when we have reached the peak, the height of our human capacities, God intervenes to do the miraculous. And that is the ones that are beyond us. God cannot do for us what he has given us the ability and the capacity to do for ourselves.
Thank you very much, sir. Thank you very much, sir. So on that note, I will call upon the chairman to give his closing remarks. Thank you very much, sir. In fact, you have shown not to be two-faced, because we noticed that anyway. For example, those of us that are health workers, when we go to church, we believe a different thing, and when we are in the hospital, we believe a different thing. Thank you very much, sir. So the chairman will make his closing remark.
Thank you very much. I want to say that this is a superb and splendid presentation. As I said earlier, that this topic is not as simple as it is, as it looks. And it has given us great insight into why medicine can be taken as why medicine is a form of, wait a minute. Okay, we gotta go again. Thank you. Yeah, why medicine is a form of a talk. Sorry about that. Okay, now very insightful, and I think he created the avenue for a very fascinating discussion from both the discussants and then from the questions that the director also posed. I think he started on a good note by talking about referencing Millennium Development Goal number 3, which has to do with good health and well-being. As such, you will agree with me, health is our most important asset and belonging, and without which nothing will be achieved. And he made it clear that communication is very, very important in the achievement of Millennium Development Goals. He went through the various components of Millennium Development Goal. Then after saying the need, in fact, that communication is indispensable in the achievement of Millennium Development Goal number 3. He also made reference to history of health communication from the ancient era to the current era, which has become digital. He now outlined some of the digital evolution and its application. He talked about artificial intelligence and its potential. He also talked about the new forms of communication, TV series, drama series, tele-evangelism, storytelling, the use of social media, influencers, who are mostly health professionals. We talked about web analysis extensively of APROCO doctor, very insightful with good examples. We also looked at digital tools that help effective communication, and also the need for feedback from patients to correct misconceptions and some lack of knowledge. We also mentioned about the need for tailoring the messages to the needs of the audience. Very, very important. So a good health, effective health communication must realize that it has to be audience focused, looking at their socioeconomic condition, their educational level, and what have you, because these will influence the reception of and the practice of the information that has been given. You also mentioned that health. Okay. You also mentioned that health communication has a very important outcome in terms of motivating behavior change, increasing knowledge retention, reducing anxiety, improving health outcome, and so on and so forth. Okay. Now, also, I want to say that you did a good job in giving practical examples, and he was even able to get us somebody to really share with us our own personal experience. Now, I also noted that this discussion was based on more of social media, but there are other dimensions also, especially in healthcare settings. We know the interaction between patients and doctors. They also help in improving health knowledge and modifying health behaviors. There are other, apart from social media, there are other channels actually to deliver health information. It can be in health setting, as I've said. It can be in community settings. It can be in the workplace. Okay, and it can be in the workplace. In fact, anywhere in the church, as he has already said. So it's not limited to social media. Now, under recommendation, he made a far-reaching recommendations on how actually to improve the effectiveness and the spread of health communication. Okay, and I think that's very insightful. There's need for to educate the professionals to acquire skills in communication, because giving knowledge is one thing, and then implication and then application of such knowledge is another thing. And that calls for the need for acquisition of certain skills and competencies for the development of health talk, especially health education. It's not a all-commerce affair. You must have to have the competencies and the skill in the planning and the implementation and the evaluation of health programs. And I think so the discussants also gave very insightful view or perspective of the need to make medicine out of health talk. As I said earlier, it looks the topic looks poetic, but you can see that the lead, the keynote speaker has been able to delve into the complexities, and we appreciate all his contributions. And on this note, I'll thank the director of School of Public Health, Professor Bex Ordinaha, for this initiative to make this issue of health promotion and communication a very good, put it as a day to discuss important issues relating to health promotion and the health talk and health promotion and the well-being of individuals and community. On this note, thank you, everybody. Thank you.
Thank you very much, Chairman. Thank you very much for that, for the closing remark. In fact, you went through, you gave us the summary of what transpired. Thank you very much. So I will quickly do a vote of thanks, and then we'll go and we'll start the closing formalities. Let me first of all thank the Vice Chancellor of our university, Professor Unare Abraham Georgeville. I'm sure that he's currently on transit, but probably most likely joined us. Thank you very much, sir, for all your assistance, and then the DVCs and all the other officials of our university. Let me thank the chairman. Chairman, thank you very much, Professor Ernest Achelo, Professor of Health and Safety Education at the University of Port Harcourt and a fellow of the Institute of Safety Professionals. Thank you very much. Thank you for the passion. Thank you for training a core of health educators. And even not only, I think you went even beyond the core, beyond the curriculum, because I saw the students. I think you brought the students to the teaching hospital, and they had useful exposure, and in fact even took part in some of the health education activities. Thank you very much. Thank you very much. I know with that, I know that you are not just interested in classroom teaching, but ensuring that people have the students have the practical exposure. I can't thank the keynote speaker enough. He was deliberately chosen for being a man of God and an academic, respected academic in that area, and he brought the experiences from those two careers to bear in his lecture. Thank you very much. Thank you very much, Professor Father Walter Hejrika, for that wonderful lecture. As I said, we have fully adopted it as one of our reading materials. We have the audio, we have the slides, so we are going to put it, even if you permit us, we are going to put it on our website, so that you mentioned even repetition. That repetition is even very important very important in achieving behavioral change. So we want to have it so that the students can play and replay until they imbibe completely the message you passed on in that lecture. Thank you very much, sir, for that. So we have to also thank the panelists, wonderful ladies, including those that couldn't make it. At times it happens, but those that made it, Dr. Doris Nria and our chairperson, Professor Godia Kenedo, they did wonderfully well. Sharing their experiences and then providing their useful insights into the topic. Thank you very much, madam. Thank you very much, madam. We appreciate. Then we also should I say the founder of the Intercontinental Wellbeing, currently domiciled in Kenya, but in Tanzania, but she's making progress. I'm sure that she'll become a household name in Nigeria in the near future. Thank you very much, madam, for your contributions and for your efforts. I must say, I have to also thank the management and the staff of the School of Public Health, especially those that came. Today is supposed to be weekend, but they are fully here. The admin secretary, the finance officer, and the other staff, Stella Amade and co, and then the technical staff. I will thank you very much for all your contributions. Thank you very much. So we will now take the closing formalities. We'll start with the university item, and then followed by the national item. So we can now rise for those items. University item, item of the University of Port Harcourt, please.
On the green lowlands and swampy plains of the New Calabar River stands the University of Port Harcourt, a citadel of learning and excellent education. All of academic enthusiasts searching for knowledge and wisdom, enlightenment, and self-reliance on mission. Our hope in the future is rooted in God. The vision of our fathers shining in the skies, opportunities unlimited and equal. Our progeny citizens of the universe, profound and in the pride of Uniport. Nigeria, we hail thee, our own dear native land. Though tribe and tongue may differ, in brotherhood we stand. Nigerians home and proud to serve our sovereign fatherland. Our flag shall be a symbol that truth and justice reign. In peace or battle honored, and this we count as gain. To hang on to our children a banner without stain. Oh God of all creation, grant this our one request. Help us to build a nation where no man is oppressed. And so with peace and plenty, Nigeria may be blessed.
Thank you very much. Thank you very much. So we have come to the end of today's section. We're not going to have the slide presentation. See? Hello? Okay, so thank you very much. So we have come to the end of today's event. There won't be any abstract presentation today, so we have come to the end. Thank you very much all. I'm sure that some of us were struggling to sing the national anthem. But my friend, yeah, mostly, he didn't have any problem because that was the item he sang when he was in primary school before the Civil War. Thank you very much. Thank you.